And how do I know if I'm getting enough vitamin D while I'm pregnant?
How do you know that you're getting enough vitamin D? Well, some people would say if you take a prenatal vitamin, then you should have adequate amount of vitamin D in your blood and for your baby. It depends on how you define what adequate in your blood is. If you are trying to prevent, for example, rickets or loss of calcium in your bones, that may be enough. Certainly is enough to prevent that. But if you're talking about achieving optimal health and having the best immune function, the best ability to fight infections, then we think you need more than that. And the best way to know that you're getting enough vitamin D while you're pregnant is to actually have a blood level checked. Okay. So you can go to your doctor and ask your doctor to check your vitamin D status. And we know that based on our research and that of other doctors, other scientists around the world, we think the target vitamin D level in your blood, it's called a total circulating 25 hydroxy vitamin D. That's very complicated. And sometimes you'll hear it said as 25 OHD or 25 hydroxy D. But that is the test that we do in your blood. And you want your level to be somewhere around 40 to 60 nanograms per ml. And if you can't get your levels checked, then you should really make sure that you're taking a prenatal vitamin and that you do get sunlight exposure during the spring, summer, and fall months. And we do worry about excessive sunlight exposure because it can cause sunburn, and recurrent sunburns can lead to damage to your skin and increase your risk of skin cancer. So so there certainly are people who will suggest that you go out in the sun for 10 or 15 minutes before you apply sunscreen. And as a pregnant woman, you also could, if you have limited access to sunlight, or if you have darker, rich skin pigmentation, then you could take, along with your prenatal vitamins, you could take 4,000 international units of vitamin D3 every day. And we found that that is what it takes to get your level to be 40 to 60 nanograms per ml, and it's safe. And that's also been shown not only by our group, but other scientists throughout the world.